Hello students, today I'll be talking about the clinical aspects of dental caries. We'll be discussing the various classifications and I'll be discussing about pit and fissure caries and smooth surface caries. Sturdivant has classified caries based on location, extent and rate of progression. According to location, there's a list of different types of caries ranging from primary caries, caries of pit and fissure till the secondary caries. According to the extent, you have incipient and cavitated caries. Incipient is reversible caries. So as you can see in the picture, it has just started. The arrow mark is showing the lesion. And then you have the cavitated caries wherein a frank cavity formation is present. Then according to the rate of progression or rate of attack, we have acute caries wherein the progression is rapid, which results in a lesion in a short period. Examples are rampant and nursing bottle caries. And as you can see in the picture, you can see many teeth are involved and it occurs in a short time. And then you have the chronic or slowly progressive caries wherein the rate of progression is slow and arrested, rate of progression suddenly stops or ceases with no caries activity further occurring. That is called as arrested caries. Now, according to location, Sturdivant has given a list of different types of caries. Now, I'm going to further split it up for easy understanding. Now, on location, depending on location, you have got three types. That is a smooth surface, pit and fissure, and root caries. So, as you can see in the pictures, this is a pit and fissure caries, and this is a smooth surface caries, but it has occurred on the root. So, it's a root caries. Then depending upon the mode of onset, you have primary or called as virgin caries, wherein caries occurs for the first time, as you can see in the topmost picture. And then you have the secondary or the recurrent caries, wherein the caries occurs in a already restored tooth because of failure of restoration. So it may occur at the margins of the restoration, as you can see in this photograph, or in this radiograph you can see there is a black radiolucent area below the crown, the filling, okay, the crown of the filling. So that is called as a recurrent caries. Next is based on the pathway of spread, that is merely a graphical representation of pathway of dental caries. You have backward caries and you have forward caries. I'll be discussing in detail further. Then, depending on the structure of the tooth involved, we have enamel caries, dentin caries, and cemental caries. So, enamel caries is when enamel tissue is involved, dentin caries when dentin tissue is involved, and cemental caries when cemental tissue is involved. Then, according to the chronology, it is classified as early childhood caries. That is, you have the rampant caries and the nursing bottle syndrome. So, it is seen during childhood. Then you have adolescent caries and then you have adult caries. So, in adult caries, you have got senile caries or cemental or root surface caries. Both come under adult type of caries. Yet another classification depending on number of surfaces involved is also there, wherein it's called a simple, compound and complex. Simple is only one surface is involved. Compound when two surfaces are involved. Complex is more than three surfaces are involved. So these are the various types of classifications of caries. Now, well, coming to the clinical usage, we have a couple of classifications. So first and the oldest one is the G.V. Black's classification, wherein he has classified into five classes: class 1, class 2, class 3, class 4, class 5, and of course a class 6 also has been added by a person called as Simon. So in class 1 you find there is caries on the occlusal surfaces of the molars and premolars, or it can be in the occlusal two-third of the buccal and lingual surface of molars, or it can be on the lingual surfaces of the anterior teeth. Class 2 is when you find carious lesions on the proximal surfaces of molars and premolars. Class 3 lesions are seen on the proximal surfaces of anterior teeth, but they do not involve the incisal angle. Class 4 The carious lesions are found again on the proximal surfaces of anterior teeth but involving the incisal angle. Then you have the class 5 wherein lesions are found on the gingival third of the facial and lingual surfaces of anterior and posterior teeth. Now class 6, as I told you, it was proposed by Simon, wherein there are carious lesions on the incisal edge and the cusp tips of the teeth. So this is the pictorial representation of the Black's classification system. So the strength is, you find that it's very simple and practical with long usage history in general dental practice, but it has some shortcomings, like it does not record non-cavitated lesions leading to underestimation of caries experience. So we have yet another classification system which was proposed by Graham Mounds. It's called as Graham Mounds classification. Now this is based on the location of caries and it takes yet another parameter, that is the size of the carious lesion. So depending on these two parameters, it is classified as that is depending on the cavity site: minimal, moderate, enlarged and extensive. So you have four sizes over here. So in size 1 pit and fissure, you find minimal will be just 1.1, 2 will be 1.2, like that it goes on increases. So you have three categories: pit and fissure, contact area and the cervical region. So again in this, whether it is minimal, moderate, enlarged or extensive has to be known. The recent classification which is being used is the ICDAS classification, that is ICDAS classification. It is nothing but the International Caries Detection and Assessment System. It is called as ICDS classification. Now the D in ICDS, it stands for dental caries detection by either the degree of dental caries, second the contour, that is whether it is pit or smooth fissure, smooth surface, and third is anatomy, whether it is crown versus root, and fourth is restoration of pit and fissure sealants. And the A in ICDS stands for evaluation of stages of dental caries, that is whether it's non-cavitated or cavitated, and the activity, whether it is active caries or arrested caries. So thus ICDS classification, you find it measures the surface changes and possible histological depth of the carious lesions depending on surface characteristics. So for this you have to examination of clean and dry teeth is the primary requirement if you have to apply the ICDA system of classification. And the instrument used is a ball-ended explorer to remove any plaque of food debris. And the ICDA scores for coronal caries varies from 0 to 6 depending on the degree of lesion, and for root caries it varies from E0, 1 and 2 depending on the degree of lesion. So here you are finding the basic description of ICDS, that is 6 categories. 0 is healthy. First one is first visual changes in enamel seen only after prolonged air drying. Then 2 is definite visual change in enamel, and 3 is localized enamel breakdown without clinical visual signs of dentin involvement. And 4 is underlying dark shadow of dentin from dentin can be seen. Fifth is definite cavity is visible with visible dentin. So you find cavitation along with visible dentin. And 6 is large distinct cavity with visible dentin. So the same thing here, it's in a, along with the pictures it has been shown. So 0 is sound tooth surface. First is just the first visual change. Second is distinct visual change. Third is enamel breakdown due to caries, but dentin is not visible. Fourth is you find the underlying dark shadow of dentin with or without enamel breakdown. And fifth is distinct cavity you find with visible dentin. And sixth is extensive distinct cavity with visible dentin. Well, coming to the codes for the roots, you have code E0, 1 and 2. So this is a description given for the, giving coding the root caries or giving the different codes for the root caries. Next, we are going to take up in detail the pit and fissure caries and smooth surface caries. And of course, I'll be mentioning about forward and backward caries also. Now, pit and fissure caries, clinically you find it will be black or brown in color and it will be slightly soft in consistency. And when a fine explorer is passed, you find you get a catch. So that is how clinically the pit and fissure caries is noted down. So this is a diagrammatic representation of pit and fissure caries, and this is a clinical picture showing the pit and fissure, the darkened pit and fissure. So you can see there is a brown to a dark brown discoloration of the pits and the fissure. So this is the pit and fissure caries. Now the adjacent bordered or the undermined enamel appears opaque bluish white, and because lot of fluorides are being used, you find there is increased integrity of the overlying enamel. Hence, the only difficult thing in pit and fissure caries is you may not be able to diagnose the underlying extensive caries or the internal caries. Next is the smooth surface caries. Now this develops on the proximal surfaces or it can be seen on the gingival third of the buccal and lingual surfaces, that is the cervical caries. And usually this is preceded by the formation of the dental plaque and it initiates just below the contact point. The early lesion will be having a chalk white opacity of enamel which cannot be detected by probe radiograph or there won't be even any enamel discontinuity. Later on it takes up a pigmentation either yellow or brown and then it starts extending. Then at that time you find the surrounding enamel can be bluish white. With progression the enamel becomes rough followed by a frank cavity formation or cavitation. So cervical caries, when you take up cervical caries, that is a smooth surface caries, a type of smooth surface caries, you find it appears as a crescent shaped lesion and it can extend from the cervical area to the proximal surface and almost always a wide open cavity will be present and it reflects lack of oral hygiene on the part of patient. So this is a clinical photograph showing the smooth surface caries. So you can see here on the canine and even the lateral and central and even the first premolar you can find the chalky white lesions, that is the maxillary premolar and the cuspid, and cavitation is present in the lateral incisor. So you can find this is a patient of rampant caries. So this is how the initial smooth surface caries appears and this is after the cavitation. So this is yet another photograph you can find here. So these are again you can find the chalky white, brown or black discoloration of this is a incipient caries or the incipient smooth surface caries and this is after a frank cavity has formed. It shows a radiolucency when you take a radiograph, the smooth surface caries, but you should have a cavity with intact surface and many of time it will not show consistent features. And involving dentino, and if it involves a dentino-enamel junction, you find a definite cavity with dentin involvement. If it does not involve the dentino-enamel junction, it will not represent a frank cavity. So smooth surface caries, thus it shows so many features. So it can show a radiolucency on radiograph, a cavity or with dentin or without dentin involvement. Now what is backward caries? Backward caries occurs due to the lateral spread of the lesion along the dentino-enamel junction. So once the enamel is involved and the DEJ ray reaches, you find the caries start spreading laterally. Now, this backward caries you find it exceeds the caries in the contiguous enamel. So, you find more amount of dentin is involved compared to the adjacent enamel over here. and the caries proceeds from the dentino-enamel junction towards the enamel. So after it undermines the enamel, you find the caries in the dentin starts spreading towards the enamel. So this is also triangle shape, but you find the base is at the DEJ and the apex is towards the enamel in backward caries. So it is spreading from the dentin to the enamel, as you can see in this pictorial presentation also. It reaches the dentin and the dentin involvement will be more compared to the enamel. So then it starts involving the enamel also. So the base will be at the DEJ and apex will be towards the enamel. That is called as backward caries. Forward caries is the usual process of caries progression you find. That is, it proceeds from the enamel towards the dentin. So usually you find the caries cone in the enamel will be larger or it will be same size as that of the dentin. And again lesion is triangle shape over here with the base at the enamel. If it is a proximal smooth surface, you find base is at enamel and apex is towards the dentin. In pit and fissure, you find the base is towards the DJ and apex is towards the pit. So that is forward caries. Now, a word about residual caries. Residual caries is nothing but the caries that remains in a completed cavity preparation. So, once you have completed the cavity preparation and you leave some amount of caries behind, so that is your residual caries. Now, this is not acceptable. You cannot just leave behind the caries if it is present, especially at the dentino-enamel junction and in any of the prepared enamel walls. These are my references. Thank you.